Let's be honest, your shift starts before you even step foot on the unit, and what you wear can really set the tone for the entire day, and that is why I love FIGS. Back in nursing school, I wore those standard boxy scrubs that felt like a scratchy paper bag, but not anymore. FIGS are so much better. They're flattering, they're super comfortable, and they're designed for people who actually work in healthcare. Plus, they're antimicrobial to help keep you protected. They're durable enough for endless washes and stylish enough that you actually want to wear them. If you're new to FIGS, I recommend starting with the Catarina top and the Cade pants. The Catarina has a relaxed, easy fit that's perfect for moving through a shift, and the Cade's cargo pockets keep all your go-to supplies within reach. You can get 15% off your first order at wearfigs.com with the code FIGSRX at checkout. That's wearfigs.com, code FIGSRX for 15% off. As the seasons shift, I'm all about finding pieces I'll actually wear long term, not just for a few months. And Quince nails it every time. Shopping on their website, and my fall uniform is shaping up to be their $50 Mongolian cashmere sweaters and premium denim jeans that fit like a dream. I'm also salivating over the coats. They look like what you'd see in a high-end boutique, but the price is very Nurse Mo friendly. Since I went to Paris this past year, I have honestly become a little bit obsessed with trench coats, and Quince's Comfort Stretch Long Trench Coat is priced at just $130 and has "Buy Me Now" written all over it. And since Quince works directly with top factories and uses premium factories, you're able to get luxury items at half the cost. Find your fall staples at Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. Now available in Canada too. That's QUINCE.com/nursemo. Well, hi there, I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in school and at the bedside. Today, we are talking about something that comes up probably early on in nursing school and then is a part of your nursing life forever. And that, my friend, is nursing ethics. And if you are about to yawn, trust me, it's not as boring as it sounds. And yes, this will be on your test. Before we hop into this topic, let's take a quick minute for our shout out, which goes out to Teresa, who is talking about my original Nursing School Thrive Guide book. And the reason I wanted to share this with you today is because I actually have a new book, a new version. But first, let's hear what Teresa said. And she said, "I'm currently in my second semester of nursing school. This is such a good book, and I believe this is a must read for anyone going to nursing school. Such a fantastic book." Well, thank you so much, Teresa. So Teresa's referencing my original Nursing School Thrive Guide. I have drastically updated and revamped and expanded this book. It is now published as the Ultimate Nursing School Thrive Guide. That is the new version. You can get it on Amazon. I'll put a link in the episode notes so that you can check it out. But if you're a new student or even still in nursing school, this book can help you in all kinds of ways. So I would definitely love for you to check that out. So whether you are a nurse, a nursing student, you're in the classroom, you're in clinical, you're practicing at the bedside, you are bound to encounter situations that involve ethics. And I get it. Nursing ethics might sound like a really boring textbook chapter, but trust me, these principles come up all the time. For example, when a patient refuses treatment, which guess what? Happens a lot. Or when your personal beliefs clash with a patient's choices. Again, happens a lot. Or when you're stretched thin and trying to give everyone equal care. Hello, this happens a lot. These are ethical dilemmas, and you must know how to navigate them if you want to be a compassionate, safe, and effective nurse. And again, this will definitely be on some kind of nursing school exam, whether you're taking a fundamentals class or like a theory of nursing class or something like that, definitely on that exam. So in this episode, we're going to be reviewing the 5 core ethical principles in nursing: autonomy, beneficence, non-maleficence, justice, and fidelity. So first, let's dive into autonomy. And autonomy is essentially the patient's right to make their own decisions about their care. Even if you, as the nurse, do not agree with their choices, your job is to respect and support their decisions. Now, think of autonomy as the foundation of informed consent, which is obtained prior to undergoing a surgical or invasive procedure. The patient has the right to hear their options, weigh the risks and benefits, ask questions, and make the final call. So how might this look in the real world of nursing? Let's look at an example. You're caring for a patient with advanced cancer. Their oncologist recommends another round of chemotherapy, but the patient declines, stating they suffered greatly with the side effects during prior treatments, and now they've decided to focus on palliative measures instead. So as the nurse, you might be thinking things like, they're giving up. Why are they giving up? Or what if this round works? And while it's really normal to feel those things because you do care about your patients, right? We want everyone to get better, but not everybody does get better. Your job is to respect and honor the patient's autonomy. So what this might look like is supporting their decision, listening to their concerns, helping coordinate with the palliative care team, educating the patient and the family on what to expect, and providing information about resources that might be available to them, such as support groups or respite care. Here's another example. Let's say you're caring for an unstable patient with an active GI bleed who refuses a blood transfusion because of their religious beliefs. As the nurse, you're likely very worried about this patient and their very low hemoglobin level, and may even feel frustrated because you know the transfusion would help stabilize them and buy them some time, right? However, autonomy comes first. As long as patients are cognitively competent to make their own decisions, we must honor their decisions. Now, not all cases of autonomy are that big and dramatic. Autonomy can show up every single shift in all kinds of ways. For example, let's say a patient refuses their medication because they don't like how it makes them feel or they just don't want to take it. That's their right. Or you've got a mom who declines to breastfeed, or an immobile patient who declines being repositioned and says, I just want to lay on my back. I'm most comfortable like this. Or a patient who declines performing oral care or letting anybody else do it. We all know that taking medication and being repositioned and doing oral care, these are all great things. But if the patient understands the consequences of not doing those things and they still refuse to do those things, that's them exercising their autonomy. And that's why education is such a key component of autonomy. Sometimes, and what I have found many times in my career, is that when the patient has more information, then they do, in a lot of cases, accept the intervention, but sometimes they still don't. For example, if the patient who refuses to brush their teeth has received education about pneumonia prevention and still refuses, that's their right. If the immobile patient has been informed they are at high risk for developing pressure ulcers, they may still continue to refuse repositioning. If that's the case, you can't force them. You can continue to educate, inform, and advocate, but at the end of the day, patients have autonomy, and it's a key component of nursing ethics and patient-centered care. Now let's talk about beneficence. This is a fancy and sometimes hard to say way of saying you're taking positive actions to help your patients and that their best interests are the priority. In other words, you're doing good things in service to others. Now, as nurses, beneficence really is baked into everything we do, like relieving suffering, promoting healing, and helping improve outcomes. So here's an example. You're caring for a patient who is scheduled for surgery. They're really anxious. You could simply give them a dose of lorazepam and go on about your day. But instead, you take the time to sit with the patient, hold their hand, talk with them, even though you're already feeling stressed by the demands of your shift. In this case, you're putting the patient's needs above your own and took a moment to reduce the patient's suffering. That's beneficence. And I feel like this one really just comes so naturally to us as nurses. Beneficence can be just those everyday things, like the patient asks for a blanket and you bring them a nice warm one, or you notice a change in condition and you speak up about it. You catch the wrong dose of medication before it's given, or you give extra pillows to a patient so they can get comfortable. Like all of those things are beneficence. One way to think about beneficence as you go through your shift is to ask yourself, what can I do to help this person feel better, heal faster, and avoid harm? Then you take steps to make it happen. Next, we have the principle of nonmaleficence. And this is another difficult to say way of basically saying do no harm. And it is one of the oldest ethical principles in healthcare. And while it may seem really obvious, it can feel a little bit more nuanced or subtle in the real world. So here's an example. Let's say you're a new grad nurse working in a busy emergency room, and you're really excited to place an IV on your 86-year-old patient. The problem is your patient has very tiny, very tricky veins. After 2 misses, the patient is clearly anxious and in pain because it hurts. You're getting flustered too, but you also really want to obtain this IV access to prove you can do it and that you're a valued member of the team. So do you keep trying, or do you make a conscious decision to avoid causing the patient unnecessary harm? Now, if you are aware of non-maleficence, then you ask a more experienced nurse or even the IV therapy nurse to step in. By doing so, the patient avoids unnecessary pain, gets the IV that they need, and you put their well-being above your own pride or your own learning opportunity. You basically did what was best for the patient. Here's another example. You're caring for a patient who's in PO for surgery, but they are really, really thirsty. You're tempted because they're so sweet and they're just asking you, begging you for just one sip of water. And you're tempted to sneak them a sip of water because you want to be kind. You want to alleviate their suffering. But that kindness could put them at risk for aspiration under anesthesia. So in this case, saying no is the best action since you're protecting the patient from future harm by doing so. Non-maleficence can also show up when we advocate against treatments that could be more harmful than helpful. For example, let's say you've got a very frail patient with a history of recurrent UTI, and they're being considered for an indwelling urinary catheter. You might raise concerns about whether this intervention is truly in their best interest since it could cause more harm than benefit. So when it comes to keeping non-maleficence at the forefront of your practice, it's really simple. Just always be thinking about ways you can minimize harm to your patients. Next, we have the principle of justice. So in a word, justice is all about fairness. It means we treat all patients equitably regardless of their background, their income, their ethnicity, race, appearance, insurance status, behavior, or even their attitude toward us. In short, justice means we deliver care without bias. So here's an example. You're working on a busy surgical unit. You've got 3 patients. One is charming, funny, polite, and his family, they're such a delight. Another is confused and argumentative, while his daughter is rude and demanding. And the 3rd patient is withdrawn and quiet, rarely asking for anything or ever even using the call light. So justice means all 3 patients get your best nursing care. It may feel easier to subconsciously prioritize the pleasant or even the quiet patient, but the challenging patient needs you too. Here's another example. You're working triage in the emergency department during a snowstorm, and a scruffy-looking young man without insurance comes in complaining of vague abdominal pain. Now, it might be tempting to assume it's not serious or that the patient just wants to get out of the cold, but justice reminds us to assess everyone the same way. Justice also shows up when we allocate limited resources, such as during a medication shortage. At the time I'm recording this episode, there is a nationwide shortage of levothyroxine. So in order to provide this medication to everyone who needs it, prescribers are limiting it to a 30-day supply. That's justice. And here's something else you might not have considered about justice. It requires self-awareness. The truth is, we all have implicit biases. The key is recognizing them, checking them, and committing to showing up equally for every patient that you care for. Things to think about as you incorporate justice into your practice are think about am I giving this patient the same attention and compassion I'd give someone else? Or would I advocate this hard if they were a different race, age, gender, or social status? Or would I advocate this hard if they were rude to me? Or am I treating people based on need or on how they make me feel? So in short, justice means leveling the playing field because everyone deserves safe and respectful, compassionate, and high-quality care. Now let's talk about the principle of fidelity. In the context of nursing ethics, fidelity means being faithful to your professional responsibilities, keeping your promises, and staying true to the trust your patients place in you. In other words, fidelity is about loyalty, honest, and follow through. Now, this one might seem kind of like a no-brainer, but it's actually very powerful. This is where nurses either build strong therapeutic relationships or unintentionally break them. So here's an example. Let's say you're caring for a patient after knee surgery and they tell you they're experiencing 5 out of 10 pain. You tell the patient, I'll be back in 15 minutes with your pain medication. But the universe has other plans and you get distracted by something going on with another patient. You finally remember an hour later, and by the time you administer the medication, the pain level is 9 out of 10, and that patient is rightfully upset. Yes, things like this happen because nursing is a dynamic activity where things often change. But to your patient, all they see is that you made a promise and you failed to follow through. This erodes their trust in you. So if you notice this happening and you realize you're not going to be able to keep your promise, you have some options. You can let them know. Say something like, you know what, it might be closer to 30 minutes, but I will come back with your meds. Or, and probably more appropriately, you delegate by asking another RN to administer the medication because you really don't want somebody hanging out in pain unnecessarily. Or if you truly do forget, because hey, guess what? You're human. You want to avoid making excuses. Instead, own it and apologize and do what you can to make it right. So here's another example. Let's say you've made a meaningful connection with a patient you've been caring for the past 3 weeks. During a difficult night of insomnia, you're talking with this patient and she confides something deeply personal to you regarding her past. Unless it's something directly related to her care or affecting her safety, fidelity means protecting that confidentiality. You don't share that story with your coworkers, you don't share it with the patient's family members, or go home and blast it on social media. I can't believe I have to say that, but I do. You hold that trust like it matters because it absolutely does. And fidelity applies to your coworkers, your scope of practice, and the policies of your workplace. For example, fidelity means you don't make up vital signs when you're in a rush. You don't say the respiratory rate was 16 when you didn't really count it. You don't document that you did a dressing change when you didn't do a dressing change. And you don't ignore unsafe practices on your unit just because it's uncomfortable for you to speak up. So in summary, fidelity is essentially doing the right thing, even when no one is watching, and even when doing the right thing is hard or a lot more work. So here's your quick recap of the 5 core ethical principles in nursing. Autonomy, respecting your patient's right to make their own choices even when you don't agree. It's their body, their life, their decision. As long as they're informed and competent, then they can have complete and total autonomy. Beneficence is always looking for ways to do good, advocating, educating, anticipating needs, taking the extra step. Nonmaleficence is do no harm. That means speaking up when something doesn't feel right, protecting your patient, even from well-meaning actions that could cause more harm than good. Justice means everyone gets equal care, doesn't matter who they are, how they behave, or what kind of insurance card they hand you. Bias does not belong at the bedside. And fidelity means being someone your patients and your coworkers can count on, keeping your promises and staying true to your professional standards and the hospital policies is fidelity. So let's take a quick break and then we'll do a little practice with some NCLEX style questions. I'll be honest, there have been times at the bedside where I second-guessed what I was hearing through my stethoscope. Was that really a murmur? Was I missing something important in all this background noise? And that is why I love my Echo Core stethoscope. Echo combines the stethoscope we already know with enhanced audio and advanced AI. It amplifies heart and lung sounds up to 40 times louder and cancels out distracting noise. So even in a noisy hospital environment, I can hear with precision. And since Echo users are shown to be twice as likely to detect heart disease, it honestly feels like having a cardiology consult right in my pocket. I trust Echo so much that I worked with their team to create a special offer just for my listeners. Right now, you can get up to $50 off plus a free customizable chest piece cover at echohealth.com/nursemo. Your purchase may be HSA and FSA eligible and may qualify for CE reimbursement. Plus, Echo guarantees you'll detect heart and lung conditions more confidently. If you don't, return it for a full refund. Go to echohealth.com/nursemo for up to $50 off plus a free chest piece cover. That's echohealth.com/nursemo.
When did making plans get this complicated? It's time to streamline with WhatsApp, the secure messaging app that brings the whole group together. Use polls to settle dinner plans. Send event invites and pin messages so no one forgets Mom's 60th. And never miss a meme or milestone. All protected with end-to-end encryption. It's time for WhatsApp. Message privately with everyone. Learn more at whatsapp.com.
All right, you ready to practice some nursing ethics? Let's start with question 1. A patient with chronic kidney disease decides to stop dialysis, stating they are tired of the treatments and want to let nature take its course. The patient is alert, oriented, and manages all their affairs independently. What is the nurse's most appropriate response? So option A, notify the provider and continue to support the patient's decision. B, tell the patient that stopping dialysis is a form of giving up and they should reconsider. Option C, involve the patient's family to persuade them to continue treatment. Or option D, delay documentation until the provider confirms the patient's capacity. So in this situation, the correct answer is A, notifying the provider and continuing to support the patient's decision. We are respecting a competent patient's informed choice, and by doing so, we're upholding the principle of autonomy. We should notify the physician, offer continued education, offer continued support, and advocate for the patient's right to make this decision, even if we don't agree with it ourselves. Okay, question number 2. While administering a routine IM injection, the nurse realizes the ordered dose seems unusually high for the patient's age and condition. What action best demonstrates the principle of nonmaleficence? Option A, administer the injection to avoid delaying treatment. Option B, ask the charge nurse to give the medication instead. Option C, hold the medication and verify the order with the prescribing physician. Option D, document the dose and monitor the patient closely for adverse effects. So in this case, the correct answer is C, hold the medication and verify the order with the prescribing physician. Non-maleficence means avoiding harm. Giving a potentially incorrect dose without verifying it puts the patient at risk. The safest action is to clarify the order before proceeding. Very good. All right, question 3. A hospital has 1 ICU bed available. 2 patients need admission. A 34-year-old marathon runner with community-acquired pneumonia, and a 79-year-old patient with multiple comorbidities recovering from major surgery. According to the principle of justice, how should the nurse advocate during the care team's discussion? Option A, recommend the younger patient receive the bed due to greater likelihood of recovery. Option B, advocate for whichever patient the attending physician prefers. Option C, suggest using objective clinical criteria to determine who has the greatest need. And option D, assign the bed to the patient with more family support to help with recovery. So in this case, the correct answer is C, suggest using objective clinical criteria to determine who has the greatest need. Justice means fair and equitable treatment. ICU resource allocation should be based on clinical need, not age, lifestyle, or social support. Question 4. A nurse is caring for a patient who recently had surgery. The patient is anxious about developing a blood clot after hearing about a family member's experience. The nurse takes time to explain how ambulation, sequential compression devices, and medication help prevent clots and offers to walk with the patient around the unit. What ethical principle is the nurse demonstrating? Autonomy, beneficence, nonmaleficence, fidelity, or justice? So the correct answer is beneficence. The nurse is acting in the patient's best interest by educating, reassuring, and encouraging mobility, and also taking the patient on a walk. All of these things contribute to better outcomes. This is a very clear example of beneficence, and it's something that you as a nurse or a nursing student do all the time, probably just as second nature. We're doing good things and promoting the patient's well-being. All right, next question. A patient recovering from a traumatic brain injury becomes confused and agitated. Although they're trying to leave the bed on their own, they don't understand the risk of falling. The nurse applies a temporary restraint per hospital policy and immediately contacts the provider for a formal order. What ethical principle justifies the nurse's actions? Autonomy, beneficence, non-maleficence, fidelity, or justice? So this is non-maleficence. The nurse is preventing immediate harm, which could be a fall, by intervening appropriately while following policy. Even though autonomy is restricted, the decision supports non-maleficence in this case because the patient does not have the capacity to understand what they're at risk for. The nurse is protecting the patient from harm when basically they can't make that safe decision on their own. And I will say, just as a follow-up to this, before putting on restraints, you would pretty much exhaust all other options to keep the patient safe, right? So we're assuming that we have exhausted all other options. Next question. A nurse tells a pediatric patient they'll return after lunch with a new coloring book for them. Despite getting pulled into an emergency situation, the nurse remembers the promise and brings the book to the child before the end of the shift. Which ethical principle is demonstrated here? This is fidelity. The nurse is keeping a promise, which helps build trust, and that's really especially important in pediatric care. By remembering to bring the coloring book, the nurse displays fidelity, which is all about loyalty, reliability, and honoring your word. Let's do a couple more. A nurse is caring for a newly diagnosed diabetic patient. The patient is refusing to attend the hospital's diabetes education class, saying they want to manage their condition their own way. The nurse listens without judgment, provides education about diabetes, information about resources that are available, and documents the patient's decision. What ethical principle is the nurse demonstrating? That is autonomy. The patient has the right to make informed decisions about their care, even if the choice differs from what you might do or what the physician is recommending. The nurse supports the patient's autonomy in this case by respecting their decision while still offering education and resources. And again, autonomy really does depend on the patient's decision-making capacity. So we're assuming in this case the patient has decision-making capacity. A nurse is triaging patients in the emergency department. Instead of seeing patients in the order they arrived, the nurse assesses each one's condition and ensures the patient with signs of severe sepsis is prioritized for immediate care. Which ethical principle is demonstrated in this situation? This is justice. Justice is about fair and equitable treatment. In this case, the nurse uses objective clinical criteria to allocate care and resources based on urgency, not just the patient's arrival time, ensuring that patients with the greatest need are prioritized appropriately. I hope this overview of nursing ethics has helped you see how much these come into play in your day-to-day shift-to-shift life as a nurse. And again, this will definitely be on one of your nursing school exams. I will hopefully see you very, very soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.